See You Now is a podcast highlighting the innovative and human-centered solutions that nurses are coming up with to solve for today's most challenging healthcare problems. Created in collaboration with Johnson & Johnson and the American Nurses Association and hosted by nurse economist and health tech specialist Shauna Butler.
In our enthusiasm for innovation, we tend to be captivated by and enthralled with the breakthrough, the excitement of discovery, and a little less so with the follow-through innovation. What's required to make it work in practice? To understand the fine details of implementation and the very human elements necessary for an idea to become a sustaining innovation. In this episode of See You Now, we meet someone who, on a daily basis, thinks about one of the key human factors required for an innovation to stick: trust, especially when it comes to vaccines. Having all the scientific information and data isn't enough to change opinions, beliefs, or behaviors if the people you're educating and caring for don't trust you.
Changing someone's deeply held fears is going to take time. Conversations are also a two-way street. Learning how to be a good listener is key, as well as having respect. If you're having a conversation with someone you don't respect, you're not going to change their mind.
Melody Butler is the nurse and infection preventionist who founded Nurses Who Vaccinate. It is her mission, along with a very dedicated global network of nurses, to build trust in order to overcome fear and misinformation, so more people will become vaccine confident, immunized, and avoid the suffering and loss from vaccine-preventable diseases.
We actually have a toolkit that is called Talking to Your Vaccine-Hesitant Loved One with Compassion and Confidence.
In 2019, outbreaks of measles hit every region of the planet, including places like the United States and the United Kingdom, where it had once been considered eliminated. Worldwide reported cases jumped 300% in the first 3 months of 2019, compared with the same period just a year earlier. In this wide-ranging conversation, we learn how Melody gained insight into the profound threat of misinformation and why she is so passionate about effective communication about vaccines built of mutual respect and trust. We discuss how she's built a global network of nurses who are prepared and ready not only to vaccinate, but to listen, to understand and to educate, and to help repair the public's trust in science. And finally, we talk about what can and does happen when vaccination rates drop drastically, as in the case of Samoa, which is part of a broader and deeply worrisome trend. And just to give you a little context about the outbreak in the beautiful island nation of Samoa, when measles arrived on its shores in October of 2019, Samoa was grievously unprepared. The government had left the door to contagion wide open by allowing the vaccination rate to fall to a staggeringly low level, hovering at 30%. That's miles beneath the recommended 95% to achieve herd immunity. And this is what put thousands of children at risk. In this tiny country of big families, the epidemic killed more than 70 young children in just 2 short months and infected thousands more, leaving virtually no one in this nation of 200,000 citizens untouched. I'm Shauna Butler, and this is See You Now. Melody, let's start out with an introduction and get to know Melody, the brilliance behind Nurses Who Vaccinate.
Sure. My name is Melody Butler. I am a registered nurse from Long Island, New York. I have been a registered nurse since 2007. I work full-time as an infection preventionist. I see an infection preventionist as a nurse educator who specializes in germs. I also run a nonprofit called Nurses Who Vaccinate. We started in 2011. Nurses Who Vaccinate is an umbrella for nurses to use in regards to advocating and promoting vaccines in whatever way they feel comfortable. So we help nurses advocate for vaccines in their workplace, in their communities, on a national level and international level as well. And we work with parents to come up with maybe toolkits that they can use to present at a PTA meeting or for, a school safety class. So Nurses Who Vaccinate, we help guide nurses down the avenue of their choice for advocacy.
Why was social media the tool and the innovation or the enablement platform that you saw was a useful tool?
So I chose social media because that was my opening ticket into my first experience into anti-vaccine misinformation. Back in 2009, during the flu season of that year, from 2009 to 2010, New York was experiencing the H1N1 flu outbreak. At this time, the H1N1 flu vaccine was brand new, and I was pregnant with one of my children. So I did some research, and when I used social media and the internet to see if this was a safe vaccine for me to take as a pregnant mother, I came across some very scary information that said that this vaccine was dangerous, it causes miscarriages, it really wasn't tested, that there was a military island, that the soldiers who received the vaccine had all gotten sick and were suffering from complications. So when I came across this information, I made a decision not to get vaccinated, and I came to work and I shared this information with my clinical nurse educator and nurse manager at the time. And my clinical nurse educator took the time to sit down with me and said, well, show me what you're basing this decision on. So I brought up the websites and I brought up all of the articles I had seen that had swayed me to be afraid of this new vaccine. And she told me to really investigate where they were coming from. And just mind you, this is a conversation that happened over a couple of weeks. You don't really get a lot of downtime in the hospital, but this was something that was going on over time. And what ends up happening is she was able to show me that these websites that looked like reputable health organizations or medical journals or news articles that looked like they knew what they were talking about really weren't credible. They had no citations. Their authors, when you dig down to see if they had any credentials, had none. And if they, were a doctor, 9 times out of 10, they were chiropractors, which don't, as far as I know, have a specialty education in immunology or vaccines or public health. And if they were saying they were a healthcare provider, sometimes they were nutritionists, which also don't have a background in vaccines and public health immunology. So I was very shocked to see that as a registered nurse, college educated, I had been misled and scammed by these websites. So then she showed me what the CDC was actually saying, and she showed me accurate evidence-based research that showed that as a pregnant mother, I should be the first in line to receive this vaccine because H1N1, that virus, was actually causing miscarriages and complications from pregnancy and deaths in pregnant mothers and their newborn children. So once I read this information, I made the decision to get the flu vaccine. Thank God I did, because if you remember, we ended up running out of the flu vaccine that year. We had a massive shortage.
Yep.
Being that I worked in a hospital, I had access to the flu vaccine pretty early on. So once I made a decision, it was very easy for me to get to. My friends and colleagues, they weren't as lucky if they didn't work in that type of setting. I had a friend who was pregnant at the same time as me. Like sometimes we do, we have our pregnancy buddies. And she was due around the same time of year. And she was carrying twins. She was very pro-vaccine, and once they realized that the flu outbreak was getting worse, she made an appointment to get the flu vaccine, but they didn't have it in her area. By the time she was able to get the vaccine, it was too late. She already had caught H1N1, and she ended up losing one of the twins from the flu. Devastating loss. And for me to see my friend suffer through this, and then to also know I could have willingly put myself in this situation. I worked on pediatrics at the time. There was no way I was going to avoid coming in contact with H1N1. We had entire hallways filled with flu patients and respiratory diseases. They were very sick children ending up in the ICU, some of them dying. It was awful. And to know that because of this misinformation on the internet, I could have willingly put myself in that situation was heartbreaking and devastating. Flash forward a couple months later, And at the time I worked nights. I came home one day. I was, tired, cranky, and I come across a page on Facebook that called themselves Nurses Who Don't Vaccinate. And they were sharing the same type of misinformation I had seen previously during that flu season, of either outdated information on incredible sources, blog posts that they were being promoted as news articles. So I reached out to the moderators of the page and I asked them, hey, did you know that these websites are not accurate, they're not up to date, and would you be willing to see what the CDC says? And this was my first now encounter with anti-vaccinators. They were very upset. They were angry. They called me a variety of very inappropriate names. And this is my first encounter with them. So I had no idea that people were this adamantly against vaccines. I thought I was doing them a favor by saying, hey, you're promoting bad information. And because I was tired and cranky, I said, all right, well, I'm not going to take this. So I started my own page, Nurses Who Vaccinate, in retaliation. And long story short, we are now
a little bit of a rebel in there in you.
Yeah. That's what happens when I'm overtired. I talk too fast and I start Facebook pages. So I started the page, and now in the year 2020, we're over 1,000 members worldwide. Our nurses are from California to New Jersey to Canada to South Africa, Australia. We partner with organizations all over the world, and we work with and support many public health initiatives, and I'm very proud of where we're going. However, in the last 10 years or so, the anti-vaccine message has definitely been amplified by our core but very vocal, well-organized group, and we still have a long ways to go and a lot of work ahead of us.
When you were mentioning that, the back and forth and it being a very public conversation, you open yourself up for a lot of criticism and harassment. Are you experiencing that, or any of the other nurses in your network experiencing that?
Every single day. And the harassment has gotten worse. I've been dealing with this over 10 years, so it's always been there. I've had death threats sent to me. I've had really scary things. I've been publicly doxxed with my information. Unfortunately, some healthcare professionals are not able to withstand the harassment. I'm a little more stubborn, thankfully. So I do stand firm, but there are times where my family and I have decided, all right, it's time to take a step back. Let's let this cool off because this is kind of getting scary, especially when it's people in my own neighborhood or very local to me that I have a little more wariness. When you're from Alaska and you're mad at me, all right, I'm not so concerned when you're saying you're going to, when you're sending me threats. But when you're the next town over and you're trying to say, next time I see you at Target, you just wait. And I'm like, oh man, this is a little more real now. So yes, the harassment has gotten real and more extreme and more often, to the point where we have now partnered up with other healthcare professionals where we, like I said before, we support each other on social media.
So you guys are way more than a Twitter handle of Nurses Who Vax.
Correct. There's a lot happening behind the scenes. And our social media is used primarily to share evidence-based research, share news articles concerning immunizations and vaccine-preventable diseases, to generate a discussion of how prominent these issues are. And if you're not following the news, it's very easy to miss the polio outbreaks in the Philippines, or to maybe hear a snippet of it in a 5-second news summary and not understand the context of what's going on behind it. So we'll share a lot of news articles on our social media sites. And we also have a membership group that allows for the nurses to go more in detail for these news stories to find out what's going on. How can they share these important stories with their patients? How can they address current myths and rumors and debunk any misinformation? And we're really big on education because I love flu shots and providing flu shots, but we want to make sure that people understand the science of it and making sure that they're going to go back next year as well. My nurses who I work and partner with, I am very proud of them. They've been able to show up to a variety of conferences and do presentations around the country. For outbreaks, they've been able to pull together education seminars for schools and for parents, for nursing homes. And that way, they're really able to help address concerns and answer those questions in person, one-on-one with these patients, and really help get the message out there. And another big part of what we do in using social media is we're connecting to the parents who at 2:00 in the morning are up late worrying about their child's shot visit the next day. What we've done is really help convince, especially a lot of these, what we call fence sitters, those who they like the idea of vaccines, but they're still really afraid of it because of whatever they've seen on the internet. We're able to really help bring education as the tool to help them not only vaccinate this time around, but to continue bringing their children to the follow-up visits year after year after year and keep their children vaccinated and themselves according to the schedule.
My experience with vaccine hesitancy is most people who are looking for information, they're open and they really are looking. And if we're not in the places where they're looking to give them accurate information, it will be filled by misinformation and inaccurate information. So somebody who is hesitant now becomes even more so reluctant and perhaps skeptical, as opposed to taking that hesitancy and converting them into someone who's confident.
Yes.
And the Vaccine Confidence Project has done an awful lot of work in helping us to understand, making sure that the public has trust in science.
Yes. So what we try to do is for those parents who are searching for answers 2:00 in the morning, just like myself when I did with that initial H1N1 outbreak, when you're searching for these results, we want Nurses Who Vaccinate and our members and our evidence-based resources that we promote and encourage to be at the forefront. And if you're writing in your neighborhood mommy group about, I'm thinking about getting the flu shot, should I get it? We want our members and our parents who we've educated to be one of the first ones to respond with encouragement and helping provide evidence-based research to help encourage those parents to vaccinate and address their questions and concerns. Because to be honest, at 2:00 in the morning, you're not going to call your doctor's office for questions about the flu shot. You're going on Google, you're going on Facebook, you're going on Twitter. So that's why Nurses Who Vaccinate, we make it a mission to be present on Google, on Facebook, Twitter, Pinterest, have a blog, making sure that our stories are being heard and people know that we're here to answer questions and concerns and to direct people to appropriate venues to get their questions answered.
You're right. At 2 a.m, when somebody's got a concern or a question, they're looking on an online resource. You are there in all of those places, but your network actually makes available the in-person. If you want to meet on a playground or a coffee shop or in your kitchen, your network has made that possible. How are you bringing those two things together?
Oh, that is one of my biggest goals for Nurses Who Vaccinate, is to really expand that. We've done that on a small level, and the more we do it, the more I see there's more of a need. I feel we cannot be in the community enough at a kitchen table and in a library. I would wish we had the resources to do this, every day, everywhere. We're doing what we can with the members that we have, and the resource, we don't have a lot of resources, but, with our bare bones, You're
making a lot happen on a couple of shoestrings there.
Yeah, I have a shoestring. This is all done in our free time. We don't have any funding. A lot of our nurses, they do this because of their passion and because they've seen patients die from vaccine-preventable diseases, and they don't want that to happen again. So they'll pay out of pocket to host one of these things at their home or at the library. They'll stop at Dunkin' Donuts on the way in and pick up whatever they think is inviting, to have a seminar. We're providing the emotional and educational support, but we really see and we understand that there is such a need, even in light of social media. People need that face-to-face, and they need that connection. And that's how we best reach our patients, is through that one-on-one, face-to-face conversation. And that's when we have our best results.
That's a really important point that you bring up. And more what we're seeing is before the moment in time when you actually need to have the recommended vaccination, having people have vaccine confidence. And one of the things that I think we're all incredibly concerned about is the number of industrialized, well-developed countries who are losing or at risk of losing their measles elimination status. I mean, this is a big deal. What's your education message about the importance of maintaining measles elimination status?
Well, it's really sad that here we are in the year 2020 and we're not anywhere closer to where we were in eradicating measles. One of my hopes is that within my lifetime, we are able to eradicate measles and chickenpox, because these are viruses that are only found in humans. So unlike flu, which you can find in pigs, birds, chickens, and whatnot, even dogs, I don't know if we'll ever really be able to eradicate influenza, or like tetanus, which is found in the soil. Tetanus is always going to be a threat to humankind, but we can eradicate chickenpox and measles. We have the technology and we have the ability. But the fact is that we've taken these steps backwards in some areas, and it's not due to lack of access. It's due to, misinformation scaring people away. It's really disheartening. And I really hope that in time we're able to use technology, whether it's really helping using social media to dispel and prevent anti-vaccine messages from being the first ones that show up in a Google search. These are dangerous tactics being used by these anti-vaccine websites. If we're able to take more control of the messaging that's getting out there, I do have hope that we will be able to educate enough people to hopefully eradicate measles in the next coming years. But we need to take action now, and we really cannot be sitting on this any longer.
You mentioned using technology. And one of the stats that I spend a lot of time talking about and thinking about is we have a tendency to focus on the pretty small segment of our population that are vaccine hesitant, vaccine resistant, or anti. But the vast majority of children who are under-vaccinated, it's a result of they've missed a well child visit. This is a group of parents who believe in vaccines, trust vaccines, want to have their children vaccinated, but because of probably a logistics or a scheduling challenge, their children haven't stayed current with their vaccine schedules. What are some of the technology approaches? Because that's not an education issue. That is, how do we just make sure that the availability and delivery of it maps to people's lifestyles?
So what I see in regard to this is not just technology playing a part in this, but increasing the access by the technicians who can administer the vaccines. So in recent years, we've finally have been able to allow for pharmacists to provide vaccines, not just flu shots, but a variety of immunizations. Now we're getting more comfortable with them administering other vaccines. We need to start looking into educating pharmacists so they can feel comfortable and confident to vaccinate children, so that we can, for those parents who can't make the well visits at their physician's offices, they are able to maybe get a prescription or, have something sent over to the pharmacy, and they can go to the 24-hour pharmacy when they are able to during whatever fits their schedule, and then get their child vaccinated. There are what we like to call in our country vaccine deserts, where we don't have access to a pharmacy or a clinic, or maybe the hours, vary, or sometimes people go there and they have an hour wait time. And, if you're a single mother of 3, that hour wait time, it may involve you taking a day off from work, which some people can't afford to do. So we need to also work on expanding access, whether it's traveling clinics that we need in parts of our country, working more with people who are able to administer vaccines, but maybe they're not necessarily pediatricians. Maybe having more mobile immunization clinics that are with nursing groups and utilizing nursing students to help get the pocket of our population that don't have access. We have a lot of underutilized people that can help with this problem, and we really should start looking into these untapped resources that we have.
How are Nurses Who Vaccinate influencing and helping to educate our policymakers?
So what we do is we help encourage and teach our Nurses Who Vaccinate members how to advocate this on a personal level. And what we do is we provide the resources that they need and help maybe have training sessions. We'll give, recommendations for them to, when they meet up with their legislators, how to speak with them and what information to provide. It's done on a one-to-one level. And it's done as, not as a member of Nurses Who Vaccinate, but it's done as a constituent, because that's what's mattering. The legislators, we've learned, they want to know what their voters feel and how their voters are thinking. And if we are able to bump up the number of pro-vaccine parents and nurses and doctors talking to legislators, we will have a profound influence. The legislators, they may not have experience in the healthcare, or maybe all they know about vaccines is what they hear on the news and from their high school bio class, depending on what they ended up specializing in. So it's really important that we are bringing up-to-date research and up-to-date articles and evidence-based information to these legislators as Nurses Vaccinate members to create just that rapport and that dialogue. That way, when the legislators have questions, they know they'll have their own vaccine nurse in their area they can go to refer to when they have these concerns. And there's a lot of them. So that's what we really try to focus on with Nurses Vaccinate members, is for them to reach out to their legislators and extend that olive branch and let them know that regardless of whatever their political views are, we all got to work together on keeping our community safe.
Yeah, it's a nonpartisan issue. It's a universal issue.
Yes.
I'm thinking how important it is that the people who have influence, particularly in policy and legislative roles, how important it is for them to speak from a place of scientific accuracy and vaccine confidence, and the difference that makes in how they establish policies. And what's coming to mind is I'm thinking about HPV, the human papillomavirus, and how Australia decided to make a commitment to that, and their policies reflect it. And the last information I read about that is that Australia, they are anticipating that within 10 years, that will be eradicated. You will not see any cervical cancers as a result of HPV. And that started, 8 years ago or so with their policies. And they've seen a precipitous drop in the incidence of cervical cancer. So the fact that their policymakers, our legislators, had a high level of confidence has made a dramatic impact. And I'm sure that you can point to several examples domestically and around the world where that has made a huge difference.
Yes. Australia is one of my favorite examples to use, because had we implemented HPV protection laws around the same time they did, we would be seeing the same kind of results. And it's heartbreaking to know that we have thousands of deaths from cervical cancer, throat cancer, mouth cancer, rectal cancer, and that could have been prevented had people been vaccinated or had access to the HPV vaccine, or just known that it's safe and effective and it works. It's heartbreaking to know that we've lost all these wonderful people, or we have cancer survivors who are now dealing with lifelong painful complications as a result of their treatments. Thank God they survived. But I know people who've gone under radical hysterectomies. They're dealing with a loss of, unless you've gone through that, you won't understand. And it's awful that we could have prevented this had their parents known that this HPV vaccine was not only available, but highly, highly recommended and very safe and effective.
Yeah, the vaccine-preventable diseases. And I'm thinking of the just recent couple of months ago in Samoa, the situation where the government actually they closed all of the schools and then had to actually close down the government to address a measles outbreak. What lessons are we learning from the very low vaccination rates there?
So we were following that. Samoa is very interesting. This was predicted quite some time before their actual outbreaks occurred. And it's really interesting to compare Samoa's measles rates to those of the surrounding country, because the areas around them that had the high vaccination rates, they didn't see too many measles cases, unlike Samoa, which obviously had I think they went down to 30 or 40% of their children were vaccinated for measles.
Yeah, 30 to 40%. That is way below the recommended 95% vaccination rate to achieve herd immunity, where people who can't be vaccinated are still protected. And then having to call in New Zealand and bring in their officials just to literally go door to door because of not having the infrastructure made it very difficult to deliver and administer the vaccines.
Yeah, and just the trust, it was also about educating the families that live there, getting them to trust the people coming in to help them. That was also a very big hurdle to overcome as well. I give them a lot of credit. The people who were working on the ground, they worked 24/7, boots on the ground, like you said, door to door. There was even a news article about how they had families with unvaccinated children hang red flags outside the door so that they knew that they needed to come there to either administer vaccines or to stay away because they were being quarantined.
And from the standpoint of the technology, what are you seeing that we're able to use to help us better understand and predict where we need to concentrate our education and support efforts?
Well, one of the things that I always thought was very fascinating is how Google comes into play when we're dealing with influenza outbreaks. And what Google started tracking was the search terms. And what we're able to see from people who were Googling flu symptoms, that we were able to see that maybe a week or two later, they would have their flu positive test results, which I thought was very interesting. And they were able to provide flu prevalence 2 weeks earlier because people were Googling this initial signs and symptoms. You know, there's more research that has to be done on this area because people can also Google signs and symptoms if they just want to know, if they're curious, or if they have a friend who's sick. But it's really interesting how the data that we collect from various websites can be used to kind of predict where the next outbreak is going to occur.
You're listening to See You Now. I'm your host, Shauna Butler, and we're talking with nurse and infection preventionist Melody Butler, the founder of Nurses Who Vaccinate, the global network of nurses educating the public on the science and benefits of vaccines, and who tweet under the handle Nurses Who Vax. Most of our conversation has focused on childhood vaccinations. Coming up, Melody and I dish on the flu fighter, vaccine champion, and nurse practitioner, Lori Boyle. Lori is a member of Nurses Who Vaccinate. In providing wound care services to the elderly, she's been concerned by the number of healthcare team members in these facilities who don't get an annual flu shot. As we'll hear, Lori, a self-proclaimed geek, has combined her love of science, superheroes, and pop culture, and made it her mission to increase flu vaccinations among healthcare providers in an effort to protect them and the eldest members of our society who they care for. This is See You Now. I'm Shauna Butler. Stay with us. When we speak about vaccinations, we tend to think about that in terms of children. But Lori Boyle, she certainly opened my eyes to understanding the vaccination needs and concerns for the elderly. And her work within being a wound management nurse and a wound care specialist and working in nursing homes. What are the messages that we're not hearing and the education we need to know about vaccines and the elderly?
So what sometimes people need to know is that there are about 5 vaccines that every older adult needs to make sure they're getting or they're up to date on. That would be their yearly influenza vaccine, the pneumococcal vaccine, the herpes zoster shingles vaccine, MMR, and Tdap. The pneumococcal vaccine helps protect older adults from the pneumococcal bacteria. And it's recommended that everyone over 65 receives the pneumococcal vaccine. And pneumococcal doesn't just cause pneumonia. Pneumococcal bacteria can cause meningitis and bloodstream infections. So it's really important that people understand that these vaccines aren't just protecting against what's in the name, but they're also protecting against the complications that can follow afterwards. We're very fortunate now to have a new herpes zoster shingles vaccine that is really highly effective. Shingles is a very painful complication that is a result of contracting chickenpox earlier in life. And the CDC does recommend that adults over the age of 60 get the vaccine to reduce their risk of shingles. And not only does it reduce the risk, it also reduces the complications if in the event the vaccine doesn't prevent it. They're not as sick for as long as a severe of a case. I mentioned the MMR vaccine, and it's really important that if people who were born after 1956, if they haven't been, they need to make sure they are vaccinated. Also, when we talk about older adults, that they are up to date with their Tdap vaccine. The Tdap vaccine protects against tetanus, diphtheria, and pertussis. And what we worried about a lot for older adults is one of the most common ways to contract tetanus is not through a rusty nail, but it's actually through gardening and getting stuck with thorns. And who do we know with the most time on their hands to have these beautiful rose gardens? Usually it's grandma and grandpa.
Yeah, I was going to say out there gardening. Yeah.
Yep. So it's really important that they are receiving their tetanus shot every 10 years.
So Melody, you're out online, and I want to hear online, not in person, but online, what is a question that you're going to get and how are you going to respond?
Okay. So some of the most common concerns that we receive, Nurses Who Vaccinate online, are either about vaccine side effects or about the schedule. And one of the most recent questions I've been getting right now is, I actually could pull up the exact question. Okay. All right. Here's one of the questions I've gotten recently. This is a real question. Can it harm my child to get several vaccines at one time? Does my child need to get all the vaccines recommended right now? So what I usually do when we are having these conversations, whether it's in person or online, I kind of use a very similar format, and it's called the case method. It's a framework of conversation that helps me maintain a professional and compassionate tone when I'm discussing vaccines, because one, is very easy to be led on a tangent, and it's very easy to get off track. So to address the question, can it harm my child to get many vaccines at one time? The case method it has CASE. And C stands for corroborate, and that's where I'm going to acknowledge the parent's concern and find some points that I agree on. And here I'm setting the tone for a respectful, successful talk. A stands for about me. At this point, I would then describe, what have I done to build my knowledge? Why should this parent trust me? What is my expertise? Then I bring in the science, S for science, and I will then go over what the science says. And then E, explain and advise, I'm going to give my advice to the patient and base my recommendation on the science. So, can it harm my child to get several vaccines at one time? What I would say for C, corroborate, is I understand that there are a lot of vaccines on the schedule. And some of these diseases we don't hear about all that often. And it can seem overwhelming to know that your child's going to get 2 or 3 shots on the same day. So that's C, that's my corroboration right there. About me, A. I have looked into the vaccine schedule. I have read several studies from around the world that explore different schedules, different times, why certain countries give vaccines when they give the vaccines, and the needs of the communities. And now I'm going to go into the science. And what I have discovered, what I've learned through these many conferences and webinars and CDC information sessions, is that there's no evidence suggesting that receiving several vaccines at one time will damage or overwhelm a healthy child's immune system. We have antigens that are part of germs, and so what the vaccines contain are little small amounts of antigens, and they are very tiny compared to the amount of antigens a baby encounters every day in their regular environment. So that was the science. And then I would go into the E, advise, explain. There's no proven danger in getting all recommended vaccines today. Anytime you delay a vaccine, you're leaving your child vulnerable to disease. It is really best to stay on schedule. So that's how I would direct a conversation of that sort.
That's fabulous. What a great approach that you've designed for anybody to use. And when you're working with parents or just members of the community, I'm thinking about where I've read these stories of parents and play dates, and they're trying to figure out how to talk to their peers about the fact that their children are vaccinated and that they encourage other people to be vaccinated. So how would you coach? What is the script like for parents, or I'm thinking like a mother-in-law or a sister who is talking with their adult child in making sure that a grandchild or a nephew or a cousin is vaccinated, and they're not from a scientific background or they're not trusted as a healthcare professional? Coach us on that script.
So I'm very glad you brought that up. One of the organizations I work with, Voice of Her Vaccines, we actually have a toolkit that is called talking to your vaccine hesitant loved one with compassion and confidence.
This sounds like something that we need to do at Thanksgiving.
Well, it's really funny. I do tend to post this around the holidays as a reminder to those. So just kind of not to worry. It's very similar to the case method, but you have to find out why they are afraid. What's making them vaccine hesitant? Have them bring up their concerns. Fear is very powerful. It's so powerful that sometimes even the effect of trying to ease it can be upsetting to the person controlled by it. And this is very true even when it comes to vaccines. Sometimes people just agree to disagree, but even then that creates a fear of your own because then you're worried about your own child being susceptible to unvaccinated children.
Yeah.
So this toolkit, what this does is it helps provide parents with a sense of confidence, and it really kind of gives some good talking points. Like even my own experience, I wasn't convinced that the H1N1 flu vaccine was safe in a 5-minute conversation. It was an ongoing over a couple of weeks. That's what I needed to really understand what I was reading was incorrect. And then here's what the real evidence says. And I always remember that. It was not an overnight conversion. I didn't just say, okay, I believe you. I'll get myself the flu shot. No, I needed my fears to be addressed. And then I needed to be shown what the evidence says.
Yeah, relationship building, rapport, trust building, all of those things.
That's exactly what it was. And I trusted my nurse care educator. Changing someone's deeply held fears is going to take time. So it's not going to happen at one play date. Conversations are also a two-way street. It's really easy to start spitting out the science right away about why vaccines are so important. Learning how to be a good listener is key, as well as having respect. If you're having a conversation with someone you don't respect, you're not going to change their mind. But if you respect the person you're talking with and you show that respect by remaining calm and you're courteous and you're professional throughout the discussion and you're not interrupting them when they're talking, that's really key in helping them establish that rapport that we discussed. And, letting them know that you care deeply about all the children being discussed, whether it's your own, whether it's theirs. You want to make sure you're providing information that they can use to make a very healthy decision. And also important to recognize that vaccines aren't perfect. We have to make sure that when we're advocating for vaccines, we're not overstating the benefits. While the vaccines are widely considered one of the greatest public health achievements in human history, they don't protect 100%. And like with any medical intervention, rare serious side effects can always occur. And what's important to stress is that we're not advocating for vaccines because they are perfect, but because they are our best choice.
Is there a technology that's got you interested or surprised you as to how useful it can be in solving some of these really difficult challenges you just named?
One thing I'm excited for in regards to the vaccines is we are using drones. I'm sorry. I was thinking, not little
drones.
airplanes. Not little airplanes.
You hit on my favorite, Melody. Yeah. I am a fan of drones.
Yeah.
My friends tease me. So what are you seeing with drones as far as improving delivery, or how are we using drones and vaccines? What's that combination?
UNICEF is employing drones to be able to provide vaccines to children who were previously unreachable. In the Pacific Islands, there's hundreds of little tiny islands, and there's no way for airplanes to land on them. There's no paved roads. And what they're doing is they're using drones to deliver vaccines to children on a regular basis. So these kids are now getting their vaccines according to a schedule. So this is a much safer, effective way to provide vaccines to these parents who desperately want them. These are the parents who are waiting 5 hours online or walking miles and miles to a clinic, and now they're able to get this direct access to a much safer, closer location.
Yeah, it's always the last mile of healthcare delivery that is the hardest and the most costly. So any of the technologies that we can use to help solve that, wow, it is exciting. When you are thinking about the ways that Nurses Who Vaccinate can grow and have even more impact, what's on your vision board?
What I would love for Nurses Who Vaccinate to do is to expand our membership, which we have plenty. We always have nurses who are very interested to join us once they've heard about us. So even though we're on the internet, it's still very hard to compete with all the anti-vaccine organizations and the voices. So I would love to have more of a presence on social media to make sure that we're pushing through all the static and that our messages are getting out there. I would love to be an organization where we can help accredit nurses for being vaccine experts. I would love to be able to have more community events. There's so much on my wish list. I can keep going. So,
no, I was going to say, this is when I'm listening to your story and the journey that you've been on. How did you decide that nursing was the career path for you to be able to achieve many of these goals?
So that's a very interesting question. And it has a very funny but real life answer. I was not planning on being a nurse in high school. My dream was to either be on Broadway or to be a doctor overseas.
On Broadway. Are you going to belt something out for us?
At the next karaoke, we'll have that as our first fundraiser for Nurses Who Vaccinate next year. How's that?
Love it.
So life gives you curveballs, and I had my first son at 18. And with that, a guardian angel, I guess, appeared and kind of directed me towards nursing. And up to that point, I thought that nurses were basically what someone had kind of clarified for me as a hospital waitress. I didn't realize
a hospital waitress. Wow, I had never heard that term.
I never realized the autonomy, the independence that nurses have. That nurses are their own profession, and they have their own standards, and they have their own criteria. That wasn't brought to my attention until I was an adult. So, it's really funny how media almost steered me away from my current profession, because that's the image that was shown to me growing up. When you think back to all the cartoons and the movies that we see of nurses being portrayed, I mean, how often did we have nurses play lead roles or, being the life-saving character? And it wasn't until I was on bed rest with my pregnancy that I did some more investigation to the nursing career. And I realized, wow, I think I'm better suited for a nurse. They were the educators, and they were the ones that
they were definitely the star of the show, right?
Yes.
It met your Broadway needs.
Not even that, but it was more or less, they were the ones who were doing the hands-on job. That's what I wanted to do. I wanted to be the boots on the ground, getting my hands dirty, holding the hands of these patients, guiding them to making the right decisions and helping heal them. And what I've come to learn in recent years is that it's a teamwork approach. There is no star of the show. We're all part of the choir. No one's more important than the other, the nurse or the doctor. We just have different ways of helping the patient. And I've learned that the ways that the nurse uses is more my style and my speed. And, nurses, we're the teachers. We are the educators. And that's what really appealed to me. And that's what led me going down the route of becoming a professional nurse.
Did you ever have the understanding of how nurses are innovators and researchers and policy makers?
No, that was totally unknown to me when I was a younger student. As a nurse, it's really opened my eyes to see all the different opportunities present in the nursing community that 15 years ago I was not aware of. I did not know of all the different ways a nurse can heal and serve their community. This is 2020, the year of the nurse. We've come a long way. It's really exciting to see what we have done in the last 20 years, but there's so much more we need to do. And I'm really excited to be this moment in the nursing profession, to be part of this movement and going forward and help shape what the future of healthcare is going to be.
You are a brave woman, Melody Butler.
Thank you.
I'm sitting here smiling with so much admiration and gratitude for your knowledge, your leadership, your courage, your star power, and the good heart that you have in really helping people to understand how to avoid something that these are preventable diseases that no one should have to experience. So again, thank you for all of the work that you do.
You're also very cool. I do want to say thank you so much for this opportunity, Shauna. This has been a great way to really get the story out there, and I'm very honored to have this opportunity to share everything Nurses Who Vaccinate has done and our plans for the future. So thank you very much.
Melody Butler is a nurse, infection preventionist, and founder of Nurses Who Vaccinate. She tweets and teaches from the Nurses Who Vax handle. You can find more about Melody and Nurses Who Vaccinate, along with links to her website and a great video of Lori Boyle appearing as Princess Leia, capturing the bright side of vaccines at seeyounowpodcast.com. We spoke to Melody from her home in Long Island, New York, with the help of producer Delaney Hafner. Building on the insights of others, Mark Twain once quipped, "A lie can get halfway around the world before the truth can even get its boots on." Having lived in Austin, Texas, where boots are a fashion staple, I totally get where he was coming from. And in listening to Melody, it's clear how much passion, conviction, time, and energy it takes to remain in these conversations. Chip and Dan Heath wrote a book called Made to Stick: Why Some Ideas Survive and Others Die. Their definition of a sticky idea is one that is understandable, memorable, and effective in changing thought or behavior. To be sticky is to be engaged, and to be engaged is to be personal, present, and to meet people where they are. Melody and her global network of nurses are providing an important public service by providing tools and resources for those who are at the point of care, the point of thought, and in this case, at the point of hesitation. Nurses Who Vaccinate are allowing time and space for conversations in an effort to build what Jeremy Farr refers to as the most important healthcare tool we have: trust. For See You Now, I'm Shauna Butler. Thanks for listening.
See You Now is created in collaboration with Johnson & Johnson and the American Nurses Association. Johnson & Johnson is proud to power up nurse-led innovation that is transforming health outcomes through skill building, leadership development, and more. The American Nurses Association ignites and celebrates nurse-led innovation to redefine quality nursing and advance healthcare for all. You can help millions of people find this podcast by downloading and subscribing to See You Now wherever you get podcasts, and leave us a review while you're there. To learn more about See You Now, visit seeyounowpodcast.com.